Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning to all of you out there in the greater Joplin area. To all of our viewing area, we say happy Sunday morning to you. Thanks for joining us for Faith in Our Hometown. We know we go out to a large area, and we're always happy to have you spend some of your Sunday morning with us. So, welcome again. My guest this morning is going to be one of those guests that might help us to think a little bit, and maybe help us to think a little bit about some of the people who might fall through the cracks if we didn't advocate for them. And so my guest this morning is going to be KJ McDonald, who works for Missouri Healthcare for All. And she's just recently gotten into that job, but that's an advocacy group. And that group tries to make sure that all the folks in our area somehow can get the medical care that they need. And how do we advocate for some of those folks? And how do we maybe try to tweak the system a little bit if we're not getting everybody what they need? So we're going to be back to talk to KJ in a moment, right after this Mercy Minute. Grab your coffee and stick around.
I have arthritis in my knees, and it was just excruciating. I wish I would have done something sooner. I found myself not able to go up and down stairs, which is bad because we realized we were going to have to sell our house. We decided just to take the worst one first, and we did. I was back to work in 6 weeks. 6 months later, I had surgery on the second one, and I'm back to work in 5 weeks. And I was a little scared, a little apprehensive, even though I knew everything that was going to happen. But I was just impressed. Life is short, and I waited. I think I waited too long.
Well, again, thanks for joining us for another Sunday morning for Faith in Our Hometown. My guest this morning, KJ McDonald, who is with Missouri Healthcare for All. She is, now this is not a dirty word, an organizer.
Yes.
There you go. And that's a good thing. Sometimes, people just say, those organizers. I'm like, well, I just say thanks be to God that there are people like you around to help everybody get their act together. Okay? So what is an organizer? Tell us about Missouri Healthcare for All. You haven't been in the job very long. So just tell us a little bit about you, and then tell us a little bit about Missouri Healthcare for All.
Absolutely. My name is KJ. I was a communication major at Missouri Southern.
I love you.
Graduated.
My name is Jay. I love somebody who uses their initials.
J and
you
KJ.
gotta like that. That works. And I was a communication major as an undergrad too.
Awesome.
You might have noticed.
That's awesome.
Go ahead.
So yeah, I did journalism, and after I graduated in 2015, I kind of got into the politics scene a little bit. I started really getting into what was happening in our country and the issues that are facing the people around us.
Sometime we got to talk about that, but everybody will run screaming from the TV. So go ahead,
yeah,
just
let's
keep
not
talking.
go there. This job kind of fell into my lap. I started in November of 2017, and Missouri Healthcare for All is a nonprofit, nonpartisan organization. We are statewide, and we were born really out of a group of faith leaders in St. Louis in 2007. They got together to listen to a speaker from a group similar to ours, Maryland Healthcare for All, and they talked about how a small group of community members got together and saw that there was a problem in our healthcare system. People weren't able to get the healthcare that they needed, and they were able to grow it to a big statewide organization, and Missouri Healthcare for All has kind of followed that same model.
Which is great,
Yeah.
because I just believe that in a country that is as blessed as ours, we should be able to take care of people.
Absolutely.
We should be able to take care of their health needs. Now again, how we do that, we're going to argue about, and we're going to come down in different places. And I understand that. But I still believe that it is incumbent upon all of us to figure out how we're going to do that. And I think that that's the role of our churches. I think that's the role of, in many ways, our government to take care of the folks that are falling through the cracks otherwise. It's the role of the churches to do it charitably. And we just got to figure out how to make all that stuff work together for the good of everybody.
Exactly.
And that's my prejudice. So if you don't want to listen to this, I guess you can turn us off on a Sunday morning. But let's hear about Missouri Health. Let's hear a little bit more about what you're up to.
Absolutely. So we're really a grassroots organization. We grew from having just one staff member at the very beginning of the organization to now we have 7 staff members statewide. They really wanted to concentrate on making sure that people in more rural areas had access to an organizer like myself who could give them the opportunities to get involved in affecting healthcare in their state.
Yeah.
So
I mean, just for our viewers, because we do such a wide area, what territory do you cover?
So I'm the Southwest Missouri organizer. So technically, pretty much the region that the show will reach to.
Good.
Yeah. So we'll.
But sorry, she doesn't come over to Kansas, probably.
I don't go to Kansas,
okay.
no. Although
or Arkansas.
No Oklahoma either.
No Oklahoma.
No, but yeah, just the area just like southwest from Springfield, essentially.
Okay, so basically Springfield kind of chops off. It's a different region, and then there's everything over here.
Yep, we've got an organizer in Springfield as well, and they cover kind of the south central area. And then we have an organizer in Jefferson County. And then all of the rest of our staff is based pretty much in St. Louis. Yep.
Okay.
We do have a policy director in Jefferson City, which is great because he's getting in there, meeting with the legislators, following healthcare policy. So what I do as an organizer is really just try to build relationships with people in the community and figure out, what are your healthcare experiences? What are your stories? Where are you seeing that our healthcare system is failing the people around you? And how can we get involved and make that better and make a change?
Yeah. And I mean, I love that part because, sometimes you really can just criticize something and go, what you're doing's not working. But the best part about you guys is that you try to work with the legislators and you try to work with the folks in the community and all the other organizations that have that kind of a dog in this hunt. Mm-hmm. And you guys try to figure out a way, how are we going to improve this? And sometimes it's going to be through legislation, and sometimes it's going to be from passing it to another group or doing whatever. But I mean, the important thing is that folks out there need care, and you guys are trying to figure out how to make it better and make it work, which I love.
Yeah, we have partners with lots of different organizations and lots of churches. Definitely a lot of our volunteer base comes from church communities and faith organizations. And so that's been the backbone of this organization, really. It's how it got started.
Well, I must say that I knew your predecessor, and I could never get her to come on the show and talk. But I will say that she was very good about feeding me stories. And things that we might be able to base a show around. So Dottie, God love you if you happen to be watching this morning. God love you.
Yes, Dottie.
But I'm grateful because my gosh, a communication major, you're eloquent. I love it so far. All right. So let's talk about some of the things you got on the horizon. What are some of the things we need to be like watching for and trying to figure out, and how can we help?
Absolutely. So one of the things that we're always doing, just regardless of what the political climate is like, is gathering stories. Because we use these stories in a variety of ways, but typically we use them when we're talking with legislators. Because sometimes it feels like they're a little disconnected from the communities around them.
Sure. So I get it. I'm pastor at 3 places now. I got Joplin, Webb City, and Carthage, and I'm like trying to figure them all out and how to stay connected to all of them. And sometimes, whatever's noisiest gets the most attention. So I get that.
Yeah.
So it's easy if you have things fall through the cracks. So yeah, sometimes we need people to help us to keep our act together.
Absolutely. And we found that those legislators really respond to being able to put a face and a story with an issue, because then it's more real, and then we can kind of pull the empathy out of them, and then that's when we really can have a conversation about what can we do to make this better.
Right.
We're nonpartisan, so we work with people on both sides of the aisle. We've had lots of bipartisan legislation that we've worked on and have had some great successes with. And we've really seen that if we can kind of make healthcare more of a moral issue, more of a values-based issue than a political issue, we can really move past those barriers that are in our way in society and get some real stuff done. So it's really exciting, and these stories are the backbone of how we can really reach real change.
And I'm just going to say, you guys ought to know this by now, but for me, anything that is a moral issue has to become a political issue. Now, I'm not saying that to upset anybody's apple cart, but I'm just saying, if we're citizens and we pay our taxes and we do all that stuff, we should have a voice. We should be caring about what's going on, and we should be caring about in my estimation, all those people that are, again, falling through the cracks who are not getting some of what they need.
Absolutely.
That's why, to me, it always is a moral issue.
Yep.
How we solve it politically, I always say to my politician friends, look, you guys are supposed to be smarter than I am about how to get this worked out. So I will tell you what the moral issues are. I will tell you what I think we need to do and what we need to take care of. How we're going to take care of it? Okay, that's when everybody's got to get in the political trenches and figure it all out, and not just get in the other one's way, but how do we figure it out together?
Exactly.
And make, for example, in this case, Missouri, how do we make Missouri a better place to be? How do we make Joplin a better place to be? How do we make Carthage a better place to be? How do we make Pittsburgh a better place to be? How do we do all that stuff? And that's really important. And it is a moral issue, at least for any of us that believe that we're here for a purpose.
Absolutely.
So what do we need to be looking at?
So our policy director in Jefferson City kind of keeps an eye on some of the bills that are being introduced. We had a great success this last legislative session. Senator Whelan, who's from Jefferson County, sponsored a bill that we kind of led the charge on, Senate Bill 982. And this protects patients from surprise medical bills related to emergency room visits. So this is a topic that whenever I talk about it, people are like, that's messed up. It's kind of a universal experience that people can relate to. And it happens when people go to an in-network hospital, an emergency room that's in-network, and then they end up getting treated by a physician that's contracted in and is not covered by their insurance as an in-network provider. So then they end up with a surprise medical bill down the road, even though they've done their due diligence to make sure that they were going to an in-network hospital. So this the Senate Bill 982 that passed now makes it so that patients don't have to foot those bills anymore, which is a really great win. People end up with unnecessary bills that they weren't expecting to have after just going and paying their regular copay. It also kind of addresses...
Yeah, because when they go in sometimes into those spots, they don't ask for this or that particular doctor. They just assume that I got to the spot where my network is supposed to work and I should be okay, because you would kind of make the assumption, and it was probably a wrong assumption, but you do make the assumption that everybody that's going to be working there is going to be working on the same, page with all those people in that network.
Absolutely, yeah. Nobody goes to the ER and gets to pick and choose who their doctor is.
You just take it's an emergency. You take the doctor that's available and you go.
Exactly, that's the point. Another issue that bill addresses is really important.
Now again, I don't think that they're not going to pay those doctors some way, somehow, but...
Yep, they're just making sure that the hospitals and the insurance companies work it out amongst themselves.
Together.
Yep.
Right.
Yep, and so it just makes sure that the patients aren't the ones responsible for that when they had no say in that at all. It also addresses going to the emergency room and being treated for things that end up not being an emergency. Not sure if you're aware of this, but Anthem put out letters a couple years ago to their to the people who have their plans saying that if you go to the ER and it turns out that it wasn't actually emergency, we're not going to cover your visit. What that does is it puts a really unnecessary stress on the patient to self-diagnose.
Wow.
For instance, there is a local business owner named Sean, who a few years ago, and he didn't have Anthem, he had a different insurer, but he was having chest pains and he went to the ER and thought he was having a heart attack. Turns out it was an anxiety attack, and they ended up with $8,000 in medical bills from that visit. So this addresses that and makes sure that patients aren't responsible for that as long as there is reason to believe that it's an emergency.
Right. And who gets to make that determination?
The insurance companies and the hospitals have physicians that will kind of make that determination afterwards, but they set a lay person standard, basically saying if the average person would think that those symptoms were emergent, it's covered.
Yeah. Well, again, so this is what this particular organization does. This is just trying to say, okay, who's taking care of everybody out there? Again, not trying to not get the hospital their money, not trying to get the doctor their money, not trying to do that, but how are we going to take care of everybody else that we're supposed to be taking care of? So we're going to be right back with KJ McDonald, who works for Missouri Healthcare for All as our regional organizer. This is Faith in Our Hometown. We'll be right back.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin.
So thanks for joining us again on another Sunday morning. Again, my guest this morning, KJ McDonald, who's the organizer for Missouri Healthcare for All. So we've been talking about some of the work you've been doing. What else you've been trying to fix out there?
So we were
Crusader organizer that you are.
Yes, we were talking about surprise medical bills. We're hoping to kind of circle back around to that next session. There are some other instances where people end up with surprise medical bills when we think that they really shouldn't. This is often seen when you go in for surgery and you're covered by your insurance company, but your anesthesiologist isn't considered a network. So then you end up with a few $100 bill.
So you're just really trying to coax the system to work a little bit better in terms of the network stuff.
It seems like there are a lot of loopholes in our system, and then the ones who end up having to deal with that are the patients, which is really unfair because we're already seeing really high premiums and co-pays and stuff like that. And so this is something that if people are getting the insurance that they need and doing their due diligence and doing their work as a policy holder, that they shouldn't be stuck with these bills. So we're hoping to circle back around to that issue, kind of pick up some of the things that slipped through the cracks with the last legislation, and really try to make it more fair for the patients. And there's another story that is kind of one that's a little bit shocking, and it's one that I go back to, and it's of this mother from St. Louis County. She had an 11 or 12-year-old son who had a brain aneurysm, and she rushed him to their hospital, their in-network hospital, and as they were there, they said, we don't have a pediatric neurosurgeon, so we're gonna have to rush your son to this other hospital that's not in network. He's gotta get into surgery or he's gonna die. So they did that, and as he was in surgery, she got a call from her insurance company saying, you need to bring your son back to the other hospital or we're not gonna cover the bills. She said, he's in surgery, I can't do that or else he's gonna die. Well, she ended up with $500,000 in medical bills from that, just from trying to save her son's life. And she was lucky that she had the wherewithal to be able to spend 2 hours on the phone every week for an entire year to talk down her bills to $100,000. And here we're looking at some insurmountable debt that nobody should be facing whenever they did everything they could to get to an in-network facility to save somebody's life. These are some of the issues that aren't as well known whenever you're talking about this kind of healthcare legislation.
And I don't, I'm going to say I don't think our hospitals, sit around trying to figure out ways to make people's lives complicated.
Absolutely not.
It's just the way sometimes all that stuff sorts itself out. But again, how do we help everybody to figure out a better way to fix it?
Right.
Which is what you're really trying to do.
Yeah, just really trying to get the insurance companies to give a little bit more leeway to these kinds of situations, because we're really talking about life and death sometimes.
And and again, let's face it, we all want our insurers to stay in business. We don't want them going out of business either.
We need coverage for sure.
We need coverage and and all that kind of good stuff. So how do we do all that? And that's why I keep saying to my politician friends, okay, good luck with that. Figure that out and figure out how you're going to fix it. But again, we have these discussions, in boardrooms and in after church on a Sunday morning about some of those things that happen in people's lives, and they're just like, I don't know how we're going to do this.
Exactly.
And so
yeah, a lot of those people just don't know what the next step is to take whenever it comes to that. So we're just hoping to kind of get around that a little bit with legislation that protects them in those instances. Something really common sense that we're hoping to work on, actually local Representative Charlie Davis sponsored a bill this past year that would require insurance companies to keep their online directories up to date, which is something you think would be common sense with the internet age. Sure. But we did a secret shopper survey actually a few years ago that showed that doctors in the area covered by the Marketplace plan, only 13% of them were in network that were supposed to be and were taking new patients within a month who said they were taking new patients. So we're talking about a lot of time that potential patients are spending on the phone trying to figure out if this doctor will take their insurance, if they'll be able to see them. So we're hoping to kind of circle back around to that this session. It didn't get as much leverage as we were hoping, but to just kind of have insurance companies be a little bit more responsible about keeping that information up to date for their patients. So that's a really common sense thing we're hoping to kind of get off of the ground. And then another thing we're always trying to look at is expanding Medicaid in our state. There are 34 states in the country now that have expanded Medicaid to cover 138% of the federal poverty level. In our state, in order to get Medicaid, you can't make more than 22% of the federal poverty level, which for a family of 3 is about $385 a month. So there are about 300,000 Missourians who fall into what we call the Medicaid gap, which is where they don't they make too much to qualify for
Right.
Medicaid, but they don't make enough to get subsidies from the marketplace and get affordable insurance. So we're always looking, we're always keeping our ears peaked for an opportunity to either through the legislators or through a ballot initiative like other states have done, really just cover that gap and get these people who have no other way to get health insurance an opportunity to get the care that they need.
Yeah, and again, I know that insurance and health care is just it's a difficult world to navigate.
Absolutely.
You know, and again, I don't want any of my friends that are doctors going out of business or even quitting. One of my doctors just retired early because he was just like, I just don't want to fight with all this stuff anymore.
Yeah.
You know, and I'm like, great.
Yeah.
You know, but you just it's tough to navigate all that stuff, and again, somebody will try to help with one thing and wind up making it more difficult for somebody else with another thing. But
Right.
then these people have found some relief, and then these people have to give a little bit more, and it's just like, I'm going to say this and probably get dinged for it a little bit. But how do we take care of the common good? I'm like just about anybody else. I don't like to pay taxes. Who likes to pay taxes? Who likes to do that? Nobody. But at the same time, I think that sometimes I got to remember that my paying taxes is a little bit of a sacred trust.
Yeah.
That I have to pay some so that the folks who are not making as much money as I do, and trust me, I'm a kept man. I don't make a lot of money, but I'm a kept man. But if I pay a little bit more, then somebody else is going to be able to manage that they wouldn't otherwise be able to do. And I just got to remember that some of this is about the common good. It's not just about me. It's about all of us, and how do we do that together? And I rely a lot on organizations like yours or the Missouri Catholic Conference for us to kind of try to wrap our brains around it and how are we going to approach this? What do we think is the best approach? What do we think is the most moral approach? And we've got to have people who are out there looking at the legislation, because I don't have time to do that.
Yep.
I mean, I got to have somebody advising me on, well, what do we think is the best solution here, the best way forward? And that's what organizations like Missouri Healthcare for All is really supposed to do. They're supposed to advocate and educate, so that we all, can kind of then make our own, because I may not agree with you on every approach that you all take, and that's okay.
Yeah.
But if I don't listen to you and try to figure out, well then, how do I know I've gotten all the information?
Absolutely.
How do I know that I don't know that I'm moving forward informed? Or if I am going to disagree with you, then I need to know what my reasons are for disagreeing with you and saying, no, this is the way we're gonna do this.
Absolutely. And that's why we're really grateful we have a policy director that's super experienced and is able to get in there and really give us the pros and the cons of all the legislation that we're seeing and all of the different various aspects of these issues. As you mentioned, sometimes when you fix something, you end up hurting another issue. And so that's something we have to really do, is kind of weigh those options when we're looking at whether or not we want to support some legislation. And that's our job. That's what we do, the heavy lifting. And then we depend on our communities around us to kind of come in and mobilize and make the legislators listen, right? Make them understand that this is a real issue for real people and that they care about what happens when it comes to healthcare policy. And that's how people can get involved. You can do it at whatever level you're comfortable with, sending an email, making a phone call, coming to a rally or a forum. It's a really great way to kind of get involved and make a little bit of a change. We're taking it just one bite at a time.
Yeah, and again, our legislators really depend upon us in so many ways to let them know who they're representing.
Absolutely.
And what are our things in that? I mean, I'll get things from Missouri Catholic Conference. We needed to contact our legislators about this, and I'm like, I don't have to contact my legislators about that. I don't need to waste their time. But there are going to be other issues where I'm going to take a legislator that's either running for office or trying to get elected or is going to get elected, and I'll bend their ear because I'm going to say, I don't think that this is the right approach, and here's what we do.
Absolutely.
And so, I just running for public office is not one of those things that I'd ever want to do. It's a tough job.
Absolutely.
And there's a lot of stuff to sort through. But again, I just keep putting in front of everybody that idea of the common good. how do we protect the common good of all of us?
Absolutely.
And how do we do some of that? So,
Yeah.
and that's why I like some of your organizations. So, what more do our listeners need to know? We got a couple minutes here. What more do we? If I could say, give your 2 minute stump speech, what do we need to do next?
Absolutely. So it's election season. So one of the things that I really suggest to people is to research where all of the candidates stand on healthcare issues. Go to rallies, go to forums, go to town halls, and ask them questions. You know, shake their hands and ask them, how do you feel about Medicaid? How do you feel about consumer protections? You know, what are you going to do to make healthcare more accessible for people in Southwest Missouri? It's a really important issue, and I think that it's a really popular issue right now. And so candidates should be out there and talking about it with the people and hearing their stories and hearing what needs to change. So that's the number one easy thing that I think people should do. If you want to get involved with Missouri Healthcare for All, you can go to our website and sign up for our email list.
We'll put that up there for a second.
Yeah. mohealthcareforall.org. You can click join and put in your information. Your address tells us what districts you're in as far as legislative,
Right.
Senate and House districts. And it lets us get a hold of you whenever there's an issue that you need to take action on or that you need to be informed about. So that's a really great way to just kind of stay in the know. We'll send out notifications anytime that we are putting together some kind of event or opportunity. We take people up to the Capitol during legislative session for what we call healthcare lobby days. So if you have time during the week to join us for those, that's a great opportunity to get involved as well. Have some FaceTime with the legislators and talk about the issues. It's a lot of fun, and it's a really great experience for most people.
Interesting versions of fun, but we're going to be right back after this Mercy Minute.
A new baby changes the world and each of us. The Sisters of Mercy devoted themselves to offering exceptional maternity and delivery care, training generations of nurses to do the same. Mercy continues to answer the same call, to not only care for your baby, but to cherish them too. Mercy, in every era, your life is our life's work. Learn why we serve at mercy.net/legacy. In Ireland, the first Sisters of Mercy were called the Walking Sisters because every day they went out in search of women and children who needed healing or help. Mercy continues to answer the same call, dedicated to the health of every woman who comes to us for care. Mercy, in every era, your life is our life's work. Learn why we serve at mercy.net/legacy.
Well, one of the things about being a hometown or a home region is that we've got to figure out how we're going to work our way forward together. And so our show this morning was exactly about that, making our way forward together. How are we going to do that? How are we going to work with politicians? How are we going to work with consumers? How are we going to work with people who need health care, which is basically all of us at one point in time or another in our lives? How do we bring all that together to the most good and the least amount of harm for everybody? And that's what organizations like Missouri Healthcare for All are really trying to do. I'm sure their organization, like any of the rest of us, are not perfect in everything that they're going to come up with or advise, but I'm telling you that we need people like them continuing to advise us as we try to make a good difference for everybody in the world. So continue to do what you can to support each other, especially in our healthcare needs. Join us next week for Faith in Our Hometown.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.